Hi everyone, good morning. Welcome to our Unit 3 discussion here in ST120. Today we're going to be talking about decontamination and disinfection of various types of instruments and equipment. So we're going to talk about your typical surgical instruments as well as like specialty items, some things that are a little bit more difficult to clean. So those are really our objectives for today. We'll talk about proper techniques applied to those instruments according to industry standards, using proper PPE. All of that usually we talk about every week. So for this week, here are your assignments. There seems to be a few more than normal, just at first glance, but these are just quick little quizzes, 10 question quizzes, 10 points. So those shouldn't take you too long. The workbook, just like last week, it does account for a good portion of your grades. There's a lot of important information in those workbook questions that you'll likely see on your exam. So don't take those lightly. Don't just skim through them. They are important. All right. So with your discussion post again, your first post is due on Wednesday. And then make sure you go back and respond. Some of you are still not going back to respond to your peers. You're getting points taken off for those. So just be careful. All right. All right. So let's get into this. Why is it important for central service techs to know how to handle decontaminated items properly? Right? That seems to be an important question because this is going to be the majority of your job. Some days you may work on the dirty side, if you want to call it that, where you're decontaminating items. Other days you might be on the clean side, where you're reprocessing the packages, putting them in the sterilizer, etc. But you never know which side you're going to be on. You have to know how to do it all because you want to be able to protect yourself from dirty items, and you want to be able to protect your patients that might come in contact with a dirty item that didn't get decontaminated properly. So it really starts at the point of use in the operating room, but also here is a really big step in making sure things are clean. So what are the goals here of what we call point of use preparation? Obviously we want to remove what we can see. That's the gross soil, not gross as in like icky. Okay, that's not what that means. Gross is like visible blood, body substances. Sometimes you can see chunks of bone. Really the surge techs up in the OR should be wiping those things down when they are used or before they get sent to you, but not everybody does that. That's another story. So if you can remove the gross debris, the gross soil, it's going to be easier to decontaminate as you go on. Okay. Also, when you do this type of point of use preparation, it's preventing instrument damage. If you let that stuff sit on it, all of this blood debris, it really can damage the items over time. It can lead to, maybe the scissors don't cut as well. Maybe they're not as sharp. Maybe the hinges aren't going to be as effective. A lot of options there. So prevents instrument damage and cross-contamination, and it keeps others safe. If you can keep things as clean as possible, obviously you're going to eliminate potential spread of disease, just like washing your hands, right? So sources of contamination, obviously things in the OR get kind of dirty, right? Used instruments and equipment, most of that comes from the operating room. Even the case carts that these dirty items come in need to be cleaned appropriately. So some facilities have a cart washer, a case cart washer. It's really like a big, think of it like a big dishwasher or maybe even like a car wash sometimes. At least at our facility, you just push them in. It's almost like a bigger room, so to speak, and it cleans them. So that's pretty cool if you have that type of thing. And then you're also going to have things from other departments that you're going to be in contact with. So point of use preparation, again, the decontamination begins at the point of use. So that should be up to the surgical technologist or the person using that item. And I teach my surge tech students this as well. So every time a surgeon gives an instrument back, even in the middle of the case, wipe it down. I keep like a blue towel or some sort of towel close by, maybe the corner of my Mayo stand that's draped. I wipe it off, right? You don't want to use like saline to soak these items. Sterile water would be better, but just to wipe it off, a little bit of saline is probably okay. I wouldn't soak it in saline though. Again, like we said before, prolongs the life of the instruments because metals can get broken down over time. You'll start to see them pit or rust, so to speak. So that's important. It saves the hospital money. Prevents or dried fluids and tissue are more difficult to remove. You're going to be doing your own activity that you're going to record, where you have a couple instruments that you've got in your kit that you're going to dirty up, right? You're going to leave them sit overnight. You're going to see that that's much harder to clean if it, as opposed to if you just got it dirty. Sometimes, let's say if you soak it in ketchup, you have ketchup on like your fork at home, you rinse it off, it comes right off, right? You leave that sit overnight, you're gonna have to scrub it a little bit. That's the same concept. So it saves a little bit of time. It also prevents you from missing debris. You don't want to miss it. And tissue and moisture promote a biofilm. So what's a biofilm? It says here, a biofilm is a way bacteria can adhere or stick to surfaces, so it becomes more difficult to remove. So it's a fun little thing bacteria can do in a way to, it's like self-preservation for them. They don't want to die because they're living creatures. They want to keep going and replicating. That's what they do. So they find a way to adhere to surfaces so they can keep on, right? So tissue can do that. So if you can eliminate that, you're going to eliminate their chance of creating that biofilm. Some other guidelines here, just to keep in mind, point of use cleaning does not replace the whole decontamination process. So you can't skip that step just because you've wiped something down. You again remove gross soil, always remove what you can see. Follow IFUs because not every instrument or supply will be the same. So once you get into it, you'll probably, repetition, you're going to learn what you can and can't do. Always separate your sharps for easy identification. You don't want to get stuck. Reusable linens, typically by this point, linens are already separated, but you could have those already, you could separate those. Some facilities will launder those linens in-house where you can re-sterilize them. Sometimes facilities will use sterilized linens. Some don't. Let's see, remove disposable items and place in a biohazard container. Disposables don't need to accidentally be mixed in with something that's going to go to decontam, because then you're going to accidentally reprocess or re-sterilize something that should not be reprocessed. So that would not be ideal. That could end up damaging the item to where it's not functional. It could hurt the patient. You don't want to do that. Open hinged instruments like your hemostats, Kellys, clamps, whatever. That way you can clean in those hinges. Things that need to be disassembled should be disassembled. That way you can get to all the parts, right? Keep in mind, don't just throw everything together, but heavy instruments go on the bottom of the tray and lighter instruments stay on top. That preserves the instrument so you don't damage like the delicate tips of the forceps or whatever. Keep instrument sets together. Sometimes this one's harder to do. It's easier said than done. If you have a big case and you have 6, 7, 8 trays of instruments, as a surg tech, that can be difficult, right? It can be hard to remember, okay, these vascular clamps came out of this vascular tray. Some facilities will have them marked a special way. That might make it easier, but ideally you want to keep them together when you return them to decontam. So makes it easier for the person in sterile processing so they don't have to find everything. Keep instruments moist. Again, that goes back to not letting it dry so it can't get that biofilm made, make it easier to clean later. And if something needs tacked, if in the middle of the case at the point of use, the surgeon's like, these medicine bomb scissors aren't cutting. There's always a big complaint with surgeons. The scissors don't cut right. They're not good enough. Don't just put it back in the tray, okay? Tag it for repair, separate it, don't put it back in the instrument tray. And an instrument technician usually comes to the facility every so often. They can sharpen it. And if they can't, they'll dispose of it and you'll get a new one. So don't just keep sending it through. All right, decontamination, when talking about transportation of the items, let's say at the end of the case, how do you get it from the OR when it's dirty to the decontamination area? Because usually there's at least a little bit of a gap between the two departments, a hallway or something. So if it came in any patient care contact, you have to consider it contaminated. You're going to use your standard precautions, right? We're going to assume even if you can't see it, even if there's no gross debris, it doesn't matter. You're going to assume that it has microbes on it, something that could lead to disease, right? So you're going to wear your PPE, you're going to wear your gloves to touch these items. Flashing, you're going to want something on your face, eye protection, mask. You're already going to be hair covered. So, and then when you're transporting the carts, this seems like common sense. Pay attention to your path, but I know how hospitals can be. Sometimes things get a little hectic in the hallways, or something maybe got put in the way that shouldn't have been there. So just pay attention that you don't knock your cart into something that might spill your dirty instruments out. And never leave carts with soiled items unattended. Again, seems like common sense, but let's say you're on your way to decontamination with your cart of dirty items. You have to pop in this room real quick to get a supply, something you have to take back with you, whatever it is. You're not supposed to leave those items just sitting in the hallway. You don't know who's going to walk by. Maybe they'll assume that it's clean. You never know, right? You don't want to potentially spread any diseases. That. So again, let's talk about our definitions here. What is clean? Okay, clean is not the same thing as sterile. Do not use those two terms interchangeably, all right? Clean means you've removed the soil and debris, but notice here it says the presence of pathogens would be minimized. It doesn't mean they've completely been eliminated. It really makes it to where it's like a handleable, is that a word? Minimum, like your tabletops, your pencils, your doorknobs, they all have pathogens on them. We still touch them, right? That's kind of the concept. Sterile requires the complete destruction of all pathogens, including spores. That's the key, including spores, all right? So if you didn't clean it properly, it can't be sterilized properly. If you accidentally leave, let's say, a chunk of bone in this orthopedic instrument, which happens, I've seen it happen, it cannot be sterilized properly. If as a search tech come back with, let's say, a Kerrison rongeur with a chunk of bone in it, the whole thing's contaminated, the whole case. So you don't want to do that. Be very careful, mindful of those things. So let's talk about our decontamination area. It's kind of a grainy picture, but it shows you the basic setup. You're gonna have like typically a 3-sink area to work with in your decontam area. So the whole purpose is to receive your soiled instruments and supplies. That's where they go first. That way they can go through the process to be re-sterilized. So we had this little discussion last week, but typically it will be cost effective to centralize decontamination. Keep it close to your operating room where you'll have the most use, right? It's going to be closest to there. And typically closest to like your ER. So it is central to the most important facilities that you're going to be using. So even, I know it seems picky, but even the floors and walls in decontam as well as the operating room have to be a certain type, okay? It can't just be your cutesy like tile, whatever. It has to be able to tolerate a lot of cleaning, chemical cleaning. So it can't be something that's going to break down very easily. Can't have a lot of cracks where things will get stuck in it, right? You don't want to have to worry about cleaning grout. It's nothing groutable, okay? Also, the air in the rooms, as well as the operating room, is very specific. Ventilation is a minimum of 10 air exchanges per hour under negative pressure. So this is a little different. The operating room is under positive pressure, and the decontam room is under negative pressure. So in the operating room, when you stand in front of the OR doors, and let's say they slide, okay, and you're standing in the hallway, the doors slide open, you're going to feel a gush of air towards the hallway. That means the air inside the operating room is positive and pushing outward. That prevents any dirty things from the hallway coming in. Now it's the opposite here in decontam. You don't want what's inside decontamination to leave this room. So it's negative pressure, okay? It keeps the dirty in this room. So that is important. So I would memorize these numbers. You're going to see these numbers on certification tests. They love to ask this type of question. As well as temperature, between 60 and 65, 68 maybe pushing it, but this is per your book, 60 to 65 degrees Fahrenheit. And humidity as well is important, 30 to 60 degrees, okay, or percent, I'm sorry. That helps prevent microbial growth. If you start getting up into 70, 80, 90, even 100% humidity, you can feel the moisture in the air. And bacteria love that. They grow, most grow pretty well in moist environments. So we try to eliminate that. Anything lower is going to be more conducive to electrostatic energy. You don't want to cause a spark that could lead to a fire. So here's our 3-sink arrangement that I mentioned before. So you have the wash sink first, then an intermediate rinse sink, and then a final rinse as your 3rd sink, okay? So each of them have very specific parameters that have to be met. And you're constantly monitoring these things, like water temperature, and your wash sink has to be between 80 and 110 degrees Fahrenheit. So you're going to have water with a special detergent or enzymatic cleaner, whereas in your rinse sink, your intermediate sink, you might have a plain or softened water with a different type of detergent. This water is going to be changed very frequently. And your 3rd sink is a different type. It's distilled, maybe deionized water, not just plain old water out of the tap, okay? This helps prevent chemical residue buildup from your detergents, which is important for the life of the instruments. So, along with decontamination, you're also going to use what's called an ultrasonic cleaner. Some places call it a sonic. I would just call it an ultrasonic. But what this does is, it's not a sterilizer. It is just for decontamination. It's for cleaning. That uses sound waves, which is pretty cool, vibrations to produce what's called cavitation. So cavitation means it's using this cleaner that creates low pressure bubbles that burst inward, which is interesting, inward. And as it's bursting, it's like dislodging soil from the instrument. It's like pulling it away from the surface as it breaks, the bubbles break, which is kind of cool. When you're using this, keep in mind that all lumens, let's say like your Fraser suction has a lumen, like a long tube, has to be filled with fluid so the bubbles get inside the lumen as well. And then hinged instruments should always be open. Anytime you're cleaning these items or sterilizing them, hinged instruments have to be open. All right, so some of our detergents that you're going to come in contact with. You have something called an emulsifier. And you'll see this not just in detergents, but maybe if you go into search tech, you'll hear about it in pharmacology as well. Emulsifiers is something that will bind two things together that don't typically bind. So in like your real life example, water and oil don't mix, right? You have to have something that goes between the two that will bind it all together. Maybe you're baking brownies. I just made brownies the other day. You have water, oil, but you also had eggs. Eggs is the emulsifier. It binds everything together, right? You have a surfactant. This is something that lowers the surface tension in the water. That helps increase its solubility of the detergent so it can work better. You have something called a chelating agent. This is something that binds the water to the minerals in the solution that helps prevent the detergents from reacting with the minerals. Sometimes minerals can do weird things, so you don't want a reaction there. And they work by, all detergents here, work by penetrating and removing soil from the instrument. That's its goal. All right, a couple other cleaning guidelines. We have 3 terms here at the top, 3 types of cleaning. You have pre-cleaning, which is at the point of use. We talked about that. Manual cleaning is something you're doing by hand. Maybe you have that scrub brush or something. And mechanical cleaning is using a piece of a mechanic, like an equipment, like that ultrasonic would be mechanical cleaning. Again, hinged items open, disassemble multi-parts, lumens, flushed, and you'll run a brush through it before you put it in. Set aside non-immersible items. So that means things that cannot be put underwater. Maybe you have special scopes that cannot be immersed. So don't immerse them, okay? Ortho instruments require bristle brushes because these types of instruments are going to have typically a lot more gross debris, bone, heavier dense tissue that it came in contact with. a little more cleaning needs to happen there. Now we separate your delegates so they don't get broken. Okay, this term disinfection is the process for making instruments safe for handling. We talked about that at the beginning, but we have something called the Spalding classification system that really dictates what type of disinfectant we need. Okay, so I put this chart on here. I really like it. So these are your examples of items that would be cleaned, starting with the non-critical. So your blood pressure cuff. You've probably all come in contact with that at some point. These things aren't going inside your body. They're not coming in contact with your blood. So they do not have to be sterilized. They only require a low-level disinfectant. Now, working our way up, this is like a gastroscope or colonoscope. That's what this is right here. Okay, this is probably a vaginal speculum. It's kind of small, but I think that's what that is. So it does go inside the body, but it's not coming in direct contact with open blood vessels. It's just mucous membranes. So your GI tract is a mucous membrane. So semi-critical, which requires high-level disinfection. Now, everything else, if you're going to be opening the belly, let's say you're doing a laparotomy, you go inside the abdomen. That is a sterile area of the body. Bacteria is not normally present there, so we don't want to introduce bacteria. So that's a critical item that requires sterilization. Some other key terms here that you're going to need to know pertaining to disinfection. So we have something called bactericidal. Anything cidal is to kill. So relating to the destruction of bacteria. We talked about disinfection. Notice again, does not kill spores. That's the key. We just talked about these three types of these disinfections. So high level is going to kill pretty much all microbes, in some spores, but not all spores. So if it doesn't kill all spores, it's not sterile. Intermediate is going to be destruction of viruses, most bacteria, even fungi. And then low level is destruction of vegetative forms of bacteria, but no spores. Okay. So briefly, let's talk about some complex surgical instruments that you might have to care for. You probably will. At most facilities, they have these. Scopes are one of them, endoscopes. There's a couple varieties of scopes that need to go in different parts of the body to see different things, right? So a rigid scope, it is what it is, right? It's rigid. It does not bend or flex. Usually made of stainless steel, very delicate, and they can be very expensive. So they have like a light cord adapter. You can hook up camera cord here to see it on a screen. Okay, semi-rigid are made of a thinner stainless steel, which allows for some bend, but not a lot. You wouldn't want to just like bend it at a 90-degree angle. So urology, like cystoscopies, you might see these. And then completely flexible, a lot of variations here, depending on what orifice you're going in, okay? Bronchoscope is going to go in the lungs. Gastroscope goes into the stomach to view. Colonoscope is colon. Cystoscope is bladder. And laryngoscope is the larynx. So we can visualize the insides of all of these openings. So these are typically flexible because the end, they can bend like pretty well to 90 by using this knob up here. So they get a better view, more of a 360 view if they need to see what's going on in there. Okay, so when we're caring for these types of endoscopes, like I showed you, let's go back one, on this rigid endoscope here, see this little metal piece sticking up? That is a light cord adapter. Those need to come off when we are caring for endoscopes for them to be decontaminated and cleaned. Otherwise, what's in those little grooves didn't get cleaned, right? We're going to use a neutral pH solution. You're going to wash gently the outside with a soft cloth. Brush your working channels. You'll have specialized brushes that will reach the entire length of the working channel. So, working channel, you can kind of see one here. Right here would be one on this. This is probably a gastroscope. Okay, it's like a little rubber opening where you can slide biopsy forceps in or whatever for surgery, but you have to make sure you brush that channel back out. If they took biopsies, which you won't know, could have gotten stuck in there. So then you're going to flush that channel out. dry it with a lint-free cloth. You don't want any lint to be on it. And then it'll go through its special scope cleaner. And then you're never going to place anything on scopes. These things are super delicate, okay, and can be damaged very easily. They cost a lot of money, a lot. So you want to be very careful, and always with that, check your IFU. A lot of places will have like a printed out step-by-step guideline next to where you're cleaning these scopes so you don't forget a step. Okay, so if you have any questions on any of these items or anything in general, please feel free to ask. Get back to your emails as quickly as I can, but I do have office hours or by appointment if you need to talk outside of those hours, it's fine. So just let me know. Have a good day. Bye.